So I'm going to start the baby's assessment or newborn assessment. I'm going to start with the vital signs. I'll start with respiration in order to look out for any breathing distress. So it's expected to find a respiration of 30 to 60 breaths per minute. You should see the chest rise symmetrically. It's expected to find irregular breathing, and so I'll listen to the breath sounds, the lungs, to look out for crackles and wheezes. I'll go ahead and listen to the heart rate for a full minute at the apical pulse. The expected heart rate is 110 to 160 beats per minute. I'll go ahead and check the blood pressure with the appropriate cuff. It's expected to have a systolic blood pressure of 60 to 80 and a diastolic of 40 to 50. I'll check the temperature, auxiliary, and the expected temperature is 36.5 to 37.5 range. I'll go ahead and weigh the baby, and it's expected to have a weight range between 2,500 to 4,000. I'll check the length of the baby. Check the length of the baby with the tape in centimeters, and it's expected to have a length of 45 to 55 centimeters. I'll assess for the general posture of the baby. So it's expected that the baby will be curled up with extremities flexed. Yep. I'll look at the skin, assess the skin, and look out for any abnormalities. The skin is expected to be pink or appropriate for ethnic background. It's expected to find acrocyanosis in the extremities, which is a normal finding, but you do not need to see jaundice in the first day of delivery. There should be the absence of jaundice the first day of delivery. I'll check for skin turgor. So the skin should be able to spring back immediately. The skin should be dry, soft, smooth, and is expected to find cracks in the palms and feet of full-term babies or post-term babies. It's expected to find vernix also in folds and creases. It's expected to find lanugo around the ears and shoulders of the infant. There are also normal deviations which can be expected. So for dark-skinned babies, you can find Mongolian spots around the butt, around the back. It's a normal finding. You can also find milia around the bridge of the nose, which is an expected finding which disappears as the baby ages. I'll go ahead and measure the circumference of the head. So the head of the baby is expected to be 2 to 3 centimeters larger than the chest circumference, and also the normal range for the head should be 32 to 36.8 centimeters. I'll go ahead and palpate for the fontanelles, anterior fontanelle, It's normally diamond shaped. It's soft, it's flat, and it's palpable. The posterior fontanelle is smaller, a little smaller than the anterior fontanelles. I also assess and palpate for suture lines, which are normally separated a little bit. And they are all normal findings. I'll go ahead with the eyes. So the eyes should be symmetrical in shape, in size. The color is normally bluish, gray, white, and according to the baby's ethnic background, the eyes should also be free from discharges and swellings. The eyes should be lined up with the ears. The pinna of the ears should be lined up. Now I'm also going to assess for perla in the eyes. So the baby's eye should, the pupil should be equal, round, reactive to light and accommodation. So I'll go ahead with the ears. The ears should be well formed with the cartilage firm. Babies are also develop sense of hearing, so they might turn their heads to direction of voices if they hear voices. They might also recognize their mother's voice. Okay, so the nose should be flat. It should be midlined. Should be broad without bridges. There can be the presence of mucus, but you shouldn't expect drainage. You would have to test for the patency of the nose, so you would obstruct the nose one after the other to check for patency of the nose. The movement of the eye, it's normally jerky and it's random because the muscles are not well, the eye muscles are not well developed. And so I'll go ahead with the mouth. So you make sure the mouth is closed. There's a closure in the palate. There's no cleft opening. And you assess for sucking, the strength of sucking. You look out for symmetrical movement of the mouth when the baby is crying. You look at the tongue. The tongue should freely move, and it should be symmetrical. The color should be pink, same as the mucosa, the palate. You can check for the patency of the palate, the soft and hard. You can check for the patency of soft and hard palate. It should be intact. Then you go ahead with the neck. It's expected to find the neck with folds, skin folds. It should be thick, it should be short. It should be able to move the head side to side, up, down. It should be able to freely move. I'll go ahead with the chest. So the chest should be barrel shaped. I'll go ahead and measure the chest. So the expected range should be between 30 to 33 centimeters. Look out for the nipples, which should be symmetrical, well formed and prominent. You also look out for extra nipples. I'll go ahead with the abdomen. So the umbilical cord, you have to make sure that there's no odor and there's no intestinal structures protruding from the umbilical cord. You should also palpate for the 2 arteries, 1 vein. The stomach is expected to be rounded with no distension. It's expected to find bowel sounds, so you listen to bowel sounds in all the 4 quadrants, and it's normally soft. You also look at the genitals and the anus. So for the anus, you have to make sure there's a presence of anus, and that is not covered by any membrane. You can also look out for the patency of the anus after the baby passes out meconium 24 to 48 hours after birth, and assess the characteristics of the meconium. For the genitals, for male infants, it's likely to find rugae around the scrotum, which is a normal finding, and also palpate for testis, presence of testis in the scrotum. The urinary meatus is also expected to be found around the penile tip, and so looking for the patency of the bladder in the urethra is likely to find the baby pass urine within 24 hours after delivery. For female infants, you're likely to find edematous labia majora, which normally covers the clitoris and the labia minora, and you're likely to find vaginal tinged blood, which is as a result of maternal hormones. And you can also look out for hymenal tag, that's the hymen tag present. I'll go ahead with the extremities. Make sure the baby has a full range of motion and is symmetrical and spontaneous. It's likely to find bow legs in infants and flat feet. You are going to test for the flexibility of the hip, and so you can do the Ortolani test, which is abduction. So Ortolani and the Ballot test. So make sure there's no clicking in these tests. Make sure the length of the legs are equal. They are symmetric. Fold the gluteal folds are symmetric, and you look out for the presence of all 10 digits in both extremities. You assess for capillary refills. The nail beds should be pink. Capillary refill should be less than 3 seconds. Make sure there are no extra digits on the extremities. The spine should be straight, midlined, and also easily flexed. When you turn the baby, it should be easily flexed. I'll go ahead with the reflexes. So for the sucking reflex, just have to stroke the cheek of the baby, and the baby will automatically turn the head to the side and look for your finger to suck. For the palmar, you grab the palm of the infant, and the infant will curl his or her fingers around your finger. The same with the plantar grasp. The infant will curl his toes around your finger, around your finger. You look out for the Moro reflex. So that's one, you kind of allow the infant to fall back to startle the infant, and he's going to extend his arms symmetrically and then abduct at the elbow with the fingers spread out. And it's normally followed by a cry because the baby is startled. The tonic neck reflex is when you turn the head of the baby to one side and the extremities on the side turn extends while the opposite side is flexed. The Babinski, you're going to stroke the sole or the feet of the baby on the outer edge, up and from down to up, and the baby's toes are going to be fan out and upwards. You can do the stepping reflex. That's when the baby responds to stepping movement when you try to put the baby in a stepping movement. So that's the end of the assessment.